Hi, today I'm here to welcome Mark Yansasky. Am I saying that right,
That's
Mark?
close enough, yeah.
Close enough. Oh,
It'll work.
You're sweet. Well, Mark is an AmeriCorps Vista and I know, affiliated with Slippery Rock University, but let's start with AmeriCorps Vista. What does that program, what does that represent?
Sure. Vista stands for Volunteer in Service to America, and we are usually college graduates who are sent out to work with nonprofits in areas that might benefit from us,
Okay.
and we help with basically whatever the nonprofit needs help with.
All right. So how long have you been doing this?
So I've been doing this about 6 months now. I started in June.
And what led you to apply for this type of position?
I knew that I wanted to change. My assistant manager where I was working kind of took me aside and he said, "Hey, it's coming up on a year now, which means you're going to start getting benefits. So if you want to do anything other than work here for the rest of your life, you need to go do that now. Because once you start getting the vacation time, you're not going to be able to leave."
Yeah.
So I took a Vista term, and I'm so happy that I did.
So you had this urge to kind of give back to the community, because I know, Mark, from working alongside community projects, you're very community minded.
Absolutely. I wanted to just kind of contribute something, and I was doing that at my old job too, but I'm very glad to be able to do kind of a more boots on the ground thing here.
And this is definitely boots on the ground, because I know about the project that you've been working on for the past 6 months. You've been busy.
Well, thank you.
Yeah. So you are working for Slippery Rock University as your Vista. Your assignment was Slippery Rock University, specifically the nonprofit institute, right? And also affiliated with Butler Succeed, downtown Butler. What was the project that you were given?
So I'm the social determinants at Health Vista.
Okay.
And the social determinants of health are all of the non-clinical factors that affect your health. Think like after surgery, a lot of people have to go home and receive support from their family members, right?
And what if they don't have that support?
Right. What if they don't have people to take care of them? What if you want to run in the morning, but your sidewalks are hazardous, right? What if you want to eat healthy, but the closest grocery store is like 15 miles away and you don't have a car? So just all of those factors that play into how healthy are you allowed to be in your given circumstance.
Right. And the list of those factors is long, and that's why we want to educate people. Like, I'm thinking about, there's been a lot of conversation and talk about the importance of financial literacy. So, for example, if somebody's been unemployed and you're like, well, the solution to that is to get a job. Well, now you help, or that individual has found a job and now they're making money, but they have no idea how to manage that money. Mm-hmm. That would be another example of a social determinant of health, right?
Exactly. Right.
So the list is quite long. And my understanding, and this is why we want to have this conversation today, is this is still fairly new, this whole conversation, right, about social determinants of health.
Yeah, and it's kind of old ideas, kind of rebranded into a new framework. When I talk to a lot of people who've been in the field for a while, they say, "Oh, you're talking about risk factors." I'm like, "Well, yes, we're talking about risk factors, but we're also talking about how it's a community issue and how all these individuals are woven together in the same kind of like framework and environment."
Right. And you know what? I think too, though, a lot of individuals that don't work maybe directly with the public, or they don't work in the nonprofit sector or social services, they might not totally understand this, or it might be something like over here, right? And I think what Mark is saying, and this is why we want to talk about this is in our community. Mm-hmm. This is our neighbors. I know for me as a teacher, this is in my classroom, and I might be okay. My family might be okay, not be okay, but maybe some of my students aren't.
Right.
And what resources can we provide them to help not only educate them, their families, and other community members?
So we've been doing nothing but making resources at the Institute. We have a coloring book here. Okay. Be Your Own Superhero. It goes through all of the social determinants of health, all the big domains, and it does it in kid-friendly language. Right. And we're hoping to distribute that to Butler area schools and to the Head Start program, so parents can go through it with their kids. We get to educate 2 people for the price of 1.
Right. And I have gone through this. I was able to see it when it was, in the working format before it was actually published. My understanding that a Slippery Rock University student designed a lot of this artwork.
Oh, absolutely. Right? I worked with such a talented student illustrator. She is fantastic.
So this has been a collaboration of many people coming together. Now, if let's just say a school that we didn't mention would like copies of this for their students, how can they go about contacting you?
They can just email us. I'm told that the email will be on the
Yeah,
bottom of the
sure.
screen here. If you email us, we'll figure out a way to get you copies. And if not physical copies, we certainly have digital versions that we can send that you can print out.
Right. And it's not only do they have materials for the kids in the schools, you also have materials for employers. You have materials for individuals. I mean, we're going on the holidays.
Right.
This isn't necessarily a happy time for everybody,
Right.
right?
We have a whole host of materials just for winter health.
Okay.
About mental health and physical health over winter, because it just does get a little bit harder to be around in the winter.
Right.
And we also have we really have resources for everyone.
Oh,
Whatever you need for the social determinants of health, we've got resources for you.
Yes, I know. And you know what? After hearing him, I know you're going to want to reach out and get to know Mark a little bit more because, as you can tell, in a 6-month period of time, you have learned a lot.
Well, thank you.
Right? And I bet your list every day is growing. More things to do?
New ideas every day.
New ideas every day. Well, it's been an honor to know you, to see the wonderful work that you're doing to help our community members. I'm proud of you.
Thank you, Tricia. That means a lot.
You're welcome. Thank you. Thanks for watching this episode of the Butler Buzz. If you want to see more, just click on the playlist button up here. To keep up to date with all of Armstrong Neighborhood Channel, click on the subscribe button down here. Hey, I suggest you do both. See you next time.